Well, first, when a new patient comes in, we do have a questionnaire, and if they have certain concerns, we always want to address those. But generally, when they come in, we use the intraoral camera, which is like a little wand, and we put that into their mouth, take some photographs of their teeth, and then we decide, hey, what X-rays do we need? Do we need a full series or just a couple? If they're complaining of pain, we get that taken care of. And then we look, and it's neat because we can put everything on a flat screen, and people start asking me questions. Hey, what about that? And then I explain it and give them a couple options, and then we decide how we're going to address it. But when I'm doing a new patient exam, one of the things that we do, I'm really nosy, if you will. I'm really looking around. One of the things we do is we give them a oral cancer screening. We have a thing called a VisiLight, where we're always looking for white tissue or very red tissue. And if the patient can't say, oh yeah, I burnt my mouth on pizza or something, if they don't have an explanation, then we watch it for 3 weeks. And if it's not better, then they're to come in, and we have this VisiLight where we let them rinse with a solution for about a minute, and then they spit that out, and then we turn the lights out, and it's almost like a kid's glow stick, and you put that in their mouth, and if it's a cancerous area, it lights up, and it's 99.9% effective. So it's really a good way of figuring it out if you have something that's suspect.